Assistant here is trying to get the attention back this way, and then once the attention is back this way, and the kid stops looking over there,
where is it?
yep, you're going to see another one. Bubbles are good. Keeps their attention. There you go. See now, playing on the video up there. And so they can switch back and forth between these two things. So this is considered what's called a VRA, or this is actually visually reinforced audiometry is what the technical term is, and this is the equipment we use for it. But they, you just keep going through this, keep the kids, it's a challenge. It's a big challenge, because you're not exciting, and what's happening up here is a lot more exciting. Although this kid likes bubbles, so that works out well. So and that's how VRA works. That's the whole point of that. So when we're doing the testing, we're trying to keep the kid's attention and trying to regulate when he or she is looking and making sure that they can hear. So they'll present at different tones, different frequencies, and different loudnesses, and find out how well the kid hears. It's not perfect, because a really, really quiet tone that you or I would raise our hands for, that kind of thing, the kid's like, yeah, it's no longer interesting. Mm-hmm. So you have to be slightly louder than what's called their threshold for them to be able to hear. But still, at this age, that's about all you can do. That's as good as it's going to get. So it does tell you quite a bit. I have no idea what's next. Questions? That was pretty much it. I have no idea how long I would talk.
33 minutes.
Excellent. 33 minutes. Find somebody's time.
How many seconds?
Questions? Yes, Mike.
Just if you want to talk about causes of hearing loss.
Sure. Excellent. I'd be happy to.
What?
Thank you.
Yeah. What?
Okay, as an audiologist, I tell you, it took me about 5 or 6 years of practicing before people would say, "Oh, what do you do?" I'm an audiologist. What?
Yeah.
I fell for it every single time. Okay, causes of hearing loss. Well, since we were just talking about kids up there, I'll kind of start on with that, because genetics has a lot to do with it. So you can be born with a hearing loss. You can be born with genetic traits that make it more likely that you will have hearing loss, either as a young child or later in life. So it's not common, but that is common enough that's why babies are screened at birth. All 50 states have laws mandating that babies are born at birth. Babies are screened at birth, which is the whole hearing screening people on the other side over there. And so so in kids, usually it's genetics. Adults, the most common thing is a noise. So if you are in a situation where you have to, if you're standing right next to somebody and you have to significantly raise your voice for that person to understand you, it's probably too loud. If you walk out of a place and your ears are ringing, it was too loud.
That was a good time.
Yeah. And what happens is with noise is when your ears are ringing, you may notice that the day after a loud concert or something, you're just not hearing as well as you did the day before the concert. Do that enough times and your hearing doesn't come back though. So your hearing drops. It's called a temporary threshold shift as a result of noise. And then do that enough times, or somebody like an occupational situation where somebody may be in noise 8 hours a day. If they're not wearing their hearing protection right, or their employer is irresponsibly not mandating that they wear the hearing protection, then they will sustain a permanent hearing loss from that. So noise is a big cause of it. Medications, even aspirin. Take too much aspirin, it will cause a temporary threshold shift. And fortunately with aspirin, it will come back when you stop aspirin. But there are other medications, there are some cancer drugs that and some antibiotics that are really, really strong and can easily wipe out your hearing. They're given only when hearing is the least of your concerns. So that's another common reason. Ear infections, either physical trauma to the ear, or even just as a result of an ear infection, an eardrum that gets ruptured. Usually that's temporary, but for a lot of people who've had ear infection after ear infection after ear infections as kids, they usually end up with a little bit of hearing loss anyways. And I'm not even going to get into tubes and all of that stuff. I didn't kind of prepare for some of that, but so there are some remedies that help you to get over that faster, some medications, that kind of thing too. So quite a few reasons why hearing loss can come about, but noise, genetics, and medications are probably the most common.
What about earbuds? Kids always using them.
Oh, yeah. Earbuds are, yeah. That can be a big issue. And I'll admit, I've been known to listen to music louder than an audiologist probably should. But yeah, we're seeing hearing loss younger and younger as a result of that, because people are turning it up too much. Especially the ones, the tighter fitting ones that really fit in there and seal out outside noise, whether it's with the foam plug that plugs it up. The more it plugs up your ear, the more likely loud is to cause problems, because all the sound is forced to stay in.
You take a sound and you put it in like a square like this, and then you make it much smaller. That way you do with an earbud, it takes very little sound to make it too loud. So if you think of it as it's all a volume thing, so as it increases, and then you make it small, the little earbuds, you put them in your ear, and there's just maybe 1 cc or half a cc of air between the two in your eardrum. It takes very little volume to run there.
Yeah, very easy, very easy. It's kind of, think about standing and talking, listening to your own voice, and you're standing in a gymnasium or a big room like this, and then doing the same thing. I'm going to date myself, in a phone booth, which nobody knows anymore. The pictures, that kind of thing. The same loudness out of your mouth in a large space is going to sound a lot softer than in a small space, which is just what Steve was saying. You put that earbud in there, you're blocking the ear, making it smaller, and you end up with.
That's all the kids all the time, like.
Yep, absolutely. It is a very, we are seeing, prior to coming to E3, I was at a university, Ball State in Indiana, and we did a lot of hearing testing on kids, and we would start to see a lot of kids who, around high school age, were starting to see little signs of some just a little bit of hearing loss, not even enough that they would have a clue that it was there. But yeah, we were starting to see it, and we'd start to dig in a little deeper, and we'd find out that, they've been listening to loud music for a long time, and that's why. Other questions? Yeah.
Okay, I've heard the term REM, or real ear measurement. What's that?
Okay, good question. I'll touch on it, but I'm going to get back into that one on another one.
Okay.
Hearing aids, a whole other side that we haven't even talked about. But obviously the information that's gleaned from these tests help to determine how much amplification somebody needs when they get hearing aids. Kind of along what Steve was saying, though, when you put something in the ear canal, depending on how far in it goes, depending on the shape of the ear canal, the size of the ear canal, can impact how much sound pressure stays in that ear canal. And so I can program a hearing aid sitting in my hand to what the hearing loss looks like on paper or on the computer, and get it to where I think it's just perfect. But then I put it in the person's ear, and their ear canal is bigger or smaller or longer, or has different consistency of tissue, and that's going to change how it sounds. And so what Jerry was asking about is real ear measurements. I would put a microphone in there and put the hearing aid on there, and I would measure exactly what the hearing aid is doing in that person's ear and make programming adjustments accordingly. And I'll talk more about that. I'll bring some of that stuff in and show some of that stuff on one of the elements. Oh, yeah.
What is the difference between an audiometer and a tympanometer?
I could say you'll find out probably in a month or two when I come back and do the second one, because tympanometry is going to be the next thing that I probably talk about. I didn't really touch on too much of this, but when we were talking about the middle ear, there could be fluid in there, or there's supposed to be an air-filled cavity. Is really what it should be air. So the eardrum should be able to move freely. All the bones in there should be able to move freely. Tympanometry is a way that we put a little probe in the ear, and it puts pressure in the ear, and it moves the eardrum back and forth. Now, if there's fluid back there, you can't compress that. It doesn't move. And so you get a tympanogram that looks a certain way. So what it does is you put the pressure in there, it moves the eardrum back and forth, it checks the acoustics of the ear as that changes, and then it draws you a picture. And a normal tympanogram has a peak, and if there's fluid back there, it's flat. And so just basically flat means the eardrum's not moving. And so that's what we use tympanometry for. And there's some other stuff that I'll talk about a little bit next time. There's muscles in the middle ear that contract to loud sounds and things like that too. But I'll touch on that as well. Other questions? I don't know. Yeah.
So how does Thomas's group test infants that are 1 day old and they can't raise their hand or look to the video screen?
There is a whole different type of hearing test. There's two actually. One is, some of you have probably heard of OEE equipment. Au.D acoustic emissions. And then there's also ABR, or evoked potentials, or auditory brainstem response audiometry. Now, Thomas and his group, they use ABR, but either ABR or OAE are acceptable for testing newborn hearing for screening purposes. And what happens with ABR is you put electrodes on the baby's scalp, and those electrodes basically look for certain brain waves. And so when a sound goes in here, I showed you, I kind of talked a little bit about the ear, the outer, middle, inner, and then I said it goes up the nerve. Well, I didn't get into the details, but really what it's doing is it's watching how it goes up the nerve. So it goes along the nerve, up through the brainstem, and as it hits certain points along this area, a signal is sent out and is picked up by the electrodes. And if the sound goes through there and you can pick up the response, then you can say, yeah, this kid's probably got normal hearing. Another way to do it is OAEs, and I'd mentioned the inner ear that has those millions of little hair cells in there. Those hair cells pick up sound, and believe it or not, they actually create a sound and send it back out as well. You can't hear it by sticking your ear up to somebody else's ear, but if you have the right equipment, you actually can pick up that emission, that it's called. And so if you can get the sound into the inner ear, get that sound back out of the inner ear, then again, you can infer that that baby's hearing is probably normal. Other questions?
The other thing I always interested wanted to talk about is the altitude. If you change altitude, like going on a plane, for example, what happens there?
I was going to touch on that, but I kind of went past it, so let me get back over to... All right. Altitude, elevators, hills, flying, your ears pop. That's normal. Your ears should pop. What happens is when you are, well, a normal functioning system. So you've got the middle ear here, which is air-filled, as I said. Normally it's air-filled. And then there is this tube right here, the eustachian tube. Here it's labeled as auditory tube. The eustachian tube that runs down to the back of your throat. Each ear has one, opens up in the back of your throat. When your ears pop, what happened is that tube opened up and equalized the pressure. So if I am just sitting here doing nothing, slowly, very slowly, the tissue in here actually kind of absorbs the air, and the eardrum starts to get drawn in a little bit. And then your ear pops. Usually when you're chewing or you're talking, you don't even know it. It does it many, many times in an hour. You don't even realize it. It's only when you have a big shift, like going up in an elevator or flying, something like that, that you really start to notice it. Or if you have a cold, it may not be opening quite as often, and when the pressure really builds up and it pops, that's more noticeable. But it happens frequently. You may not even realize it. And so what happens when you are flying, if you've got a cold, I mean, who in here has flown with a cold? And who in here who's done that hurt afterwards and really didn't like it? What happens when you have a cold? Your throat's all inflamed. You've got mucus back there. You've got just a bunch of gunk. So even though this tube wants to open, the back of your throat's all covered with stuff and it can't. And so when this can't open, the air in here slowly starts to go away. Either because just through normal processes, or when you're flying, it does it so fast as the pressure changes in the plane, the eardrum gets drawn back in here and gets sucked back in there. Very uncomfortable. If it sits that way long enough and doesn't pop, it can actually go in here and just be like just almost covering the entire middle ear and just like plastered in there. What happens after that though is it's elastic. It wants to pull back out. It'll start pulling back out, and when it does, it starts drawing fluid from the tissue here. In some cases, it can be blood or just some mucus and things like that, and that will come back to this position, but now this is fluid-filled instead of air-filled. That's an ear infection in most cases. So if you've flown and it hurt, it's probably because your eardrum was pulled in a lot further than you would like it to be.
It's kind of achy, David.
Yeah, it is. And what happens in kids who have these a lot, because this eustachian tube, in an adult, it's at a pretty steep angle, so anything that may start to go up there, gravity helps you to work it back out. In kids, it's much more horizontal. And so kids are more prone to ear infections because if something gets in there, it's not as easy for that to drain back out. And so in cases where kids have a lot of ear infections, they will make a tiny little hole in the eardrum, put a little tube in there, it just looks like a little sewing bobbin, a tiny little, like, couple millimeters across. and it'll stay in there, and that will serve to equalize the pressure until the kid grows up and the eustachian tube is more like this and they can do it on their own.
And then just take the tube out at that point.
Usually they come out on their own. Almost always they just fall. You don't even realize it. Quite often they come out 6 months, a year after they go in, and you don't even know it.
It doesn't affect your hearing in a material way.
It does not. It does not. They put it into a place in the eardrum that really, it's a little bit more flaccid. It's not as responsible for transmitting a sound. Yeah.
Some people have more wax than others.
Good question.
People like Jennifer.
It can vary sometimes. I mean, anything, allergies can do it. Some people just have more. Different nationalities actually produce either different consistencies of wax or different amounts of wax. So, I mean, we're not going to get into consistency of your wax. But quite often, allergies will. But a big thing is, it's not that some people produce more, it's that their ears may not be cleaning themselves the way that they should. So in your ear canal, this picture doesn't have it, but in the outer 2/3, there are little hairs, which, well, when you get older, guys, you're not little anymore.
Do that little beep when they die off?
No, different hairs.
Different
The
hairs.
hairs that make your ears ring are in here. Those are the little hair cells. This is just hair. This is just hair. And so the skin in the ear canal grows and slowly grows out, and the hairs also serve to push the wax out. So it's a self-cleaning mechanism. It comes out a little bit, it tickles a little bit, that kind of thing. Some of it falls off, probably don't even know, a little, it just flakes off, don't even know. But if you push it back in there too far, then it can't do that as well. If it will eventually, if more wasn't being produced, but I mean, one of the coolest things that I saw is I saw somebody who had a little scar on their eardrum. They had somebody, I don't know if they had it cut open or something like that to drain the fluid or something like that. But I saw them over a period of time, and I actually was able to watch that scar grow along the eardrum and grow out here. And the scar literally moved because the skin moves. It took probably about a year before I saw it out here, so it's really, really slow. But we produce wax faster than that, so if the wax gets back here, it can't come out on its own. So people who have wax problems, typically it's because the ear wasn't allowed to do what it should do.
What do you think of those wax drops that they sell?
Yeah, they're good.
They're
I've
good?
used
My
them.
mom has problems. She's got her ears are always plugged. She's always dizzy. She uses that a lot.
Yeah, the wax, the
Those are
drops, yeah, the drops are fine. Now, if anybody in here, and I'm not trying to say anything's bad or whatever, I'm not trying to give my own opinion, but I'm going to give it once. If you've heard of ear candling, it doesn't work. It has nothing to do with getting wax out. You can light an ear candle and
Light
put it
your
in
hair
here.
on fire.
Well, yeah, and I can. It's basically a wax paper cone that you light. You put it in the ear, you light, and supposedly it draws the wax out. And the way they say that you know this, because when you pull it out of the ear, there's a whole bunch of wax down at the bottom. It's wax paper. The wax melts. You can put it in your hand, and you end up with the same ball of wax when you pull it out. Yes, it is.
Now you gave away the trick.
That's right, that's right. But if you have wax problems, yeah, you can just, like Miriam's got an over-the-counter earwax kit, put some drops in, let it sit there for a few minutes, you've got a little
Foams,
syringe,
tickles.
and yeah, and you squirt it in there, your peroxide works, baby oil works, yeah, so there's those things work fine, yeah.
Just wondering.
Actually,
Thank you.
yeah.
How come sometimes your ear rings? Like not
Like all of a sudden,
constantly,
you're like,
Right.
oh, me too,
I-
Brett,
My
me too.
ears ring, someone's talking well about it.
I'm gonna give you the honest answer, I don't know.
Oh, that's okay. They don't.
Nobody really truly knows why. But it's more common in hearing loss. But if you have it where you hear it and it goes away, that's normal. Totally normal. It's a problem when it comes on and just doesn't ever go away. That may be a sign of hearing loss. Again, that can be caused by some medications, that kind of thing. But if it's just that random periodic, it rings, goes away, you don't even realize it went away, that's very normal. But even with hearing loss, the weird thing is we say it's our ears ringing, and this can be a really debilitating problem. I mean, it can make people, sometimes it can be so loud and so frustrating, it can make people suicidal. I mean, it is a serious problem for some people. And I've seen in a couple of patients where the surgeon that I worked with went in and actually cut the nerve. The person couldn't hear anymore, but the ringing was still there. So the ringing isn't necessarily coming, we may think it's in our ears, but it's really coming from something up here that just makes us think. It's kind of like, you know, somebody who loses an arm, they may still, their finger's still itch. So it's kind of a phantom thing. But in the case like you're talking where it just comes on and goes, that's normal. Nobody really knows why, but it just is normal.
It could be coming from the ear. It may not be.
Right, and it could be coming from the ear, yes. There are some cases, it's actually, there's something called spontaneous, I've mentioned otoacoustic emissions. You can actually have spontaneous otoacoustic emission, where you put that in there, and you can actually just measure a sound coming out of somebody's ear. They're not doing anything, you're not introducing anything, it's not anything that's being, it's just they just have, it's very rare, but that can happen. And that is coming from the ear. Yeah.
On a similar topic, from time to time I get what is called, what I call the hum. It sounds like a car motor off in the distance that just doesn't go away until you kind of, you know, do that type of thing. What would physically happen in the ear in order to cause it?
What's probably happening at that point is, I was talking, you know, your ears pop on a regular basis.
Yeah.
Right before they pop, or as the eardrum gets pulled in, which it's normally just doing that all the time, but as it gets pulled in there, your hearing goes down just a little bit. So when your ears pop, all of a sudden it's like, wow, I hear really well now, this is great.
Yeah.
If you have, it's possible to have constant tinnitus, or the ringing in the ear. It's possible to have constant tinnitus, and then when this gets pulled in a little bit, it just makes things that much quieter. It's like putting an earplug in,
Right.
and so it's just easier for you to hear that sound.
Okay.
It's all the concerts you've been to.
Maybe.
But that's most likely what it is.
Okay.
So it's probably there, you just don't always notice it because there's enough sounds around you, but then when your ears need to pop, it's kind of giving you enough of a blockage that you can all of a sudden notice.
Yeah, because you get that hum that sounds
Right.
like a motor way
Yeah.
up in the distance. Like,
Yeah.
huh?
Yeah, no, I don't know what you're talking about. What's that?
Nobody else has that.
No, never. Really? Oh my God, you need an MRI today.
Ridiculous.
Other questions?
So just a real high level, what's the hearing system have to do with balance?
Ooh, that's a whole. Now, this is one I could literally teach a whole. I used to teach a whole course on. Balance is my thing. All right, it's really not the easiest to see in here. This kind of the snail-like organ is for hearing, so that's what picks up the sounds of hearing. There are 3 canals which you can't really see as well in this picture. But those canals are also fluid-filled. They also have little hair cells, so as the fluid moves, it's detected by those little hair cells. So if I turn my head like this, the fluid, you think about a bucket, you flip the bucket around, that kind of the fluid stays there. I turn my head, the fluid stays in one place, but my head's moving, and so the hairs move in one direction, and it's telling my brain, hey, I'm moving this way, or hey, I'm moving this way. And so your inner ear has the mechanism that allows you to maintain your balance. It's called the vestibular system is what that is. So it detects motion, it detects gravity, so if I put my head down like this, I know I'm putting my head down like that, even if my eyes are closed. And then it tells your brain what to do with that, or it tells your brain what's going on so your brain knows what to do with that information. So just a quick example is if I turn my head like this and I'm looking at my finger, I can keep my finger in focus. If my vestibular system wasn't working, I wouldn't be able to do that because my eyes wouldn't be able to track it fast enough to know, you know, to keep fixated on my finger. But my ears are saying, okay, I'm moving to the left at this velocity, move the eyes that same velocity in the opposite direction. Okay, we're now back the other direction, I'm moving to the right, and so it's my brain, my ears are telling my brain what's happening, so my brain can tell my eyes what to do. So anybody who's ever had a few too many to drink, you're walking down the street and the whole world's bouncing up and down, that's called oscillopsia, and that means your ears, well, your ears are working, and they're talking to your brain, but your brain doesn't care. So it's just saying, yeah, I'm just floating along, I don't care. So that's, yeah, so your ears are really, I mean, it's one, there are three systems of balance, and your ears are one of the key ones. And that'll be another topic too that I can go
Why do little kids like to spin in circles?
I was just about to ask that.
5 to 10 minutes.
What's up with that?
I don't have the answer to that other than kids like to experience different
I
sensations.
thought I would have something
So,
to
I
do with maybe that.
Why do kids lick the table? You know, it's
My kid doesn't do that, but he does that.
I was one of those.
What if you
loved
go
it.
like this and you get really dizzy? Is that
I
normal?
love it. Yes, it is.
Okay,
I used to. I'd sit there and do all the. I was one of those kids. Probably not that long ago. Probably still did some of that stuff.
Well, sure, they
Which-
tell you broke your arm.
That's right. But that's kind of the fun part of the balance side of stuff because some of the equipment we get to put in, they need somebody to volunteer to do some of this stuff. So, so yeah, but the ear is it's really kind of a fun thing, and when it comes to balance, it's really cool, and I'm more than happy to answer more questions.
Where do they
Well,
ear
vertigo, what happens when you have vertigo?
What happens when you have vertigo?
Yeah.
A lot of things happen when you have vertigo. And I'll answer
fall
your question in
down.
just a second. Yeah, you fall. Vertigo, where the world is spinning,
Right.
or you feel like you're spinning within the world, typically is that one of your ears is not responding the way that the other one. I see Kay back there doing this kind of thing. So you may be right, because one ear is working harder than the other, and your brain doesn't know what to do with. It's expecting the same information from both, and it's not getting that, and so it's constantly thinking, I'm turning one direction or moving one direction. And like I said, when I turn, my eyes reflexively go in the opposite direction. If I'm standing here and my brain thinks I'm turning, my eyes are constantly beating. So if you want to have those of you with kids or neighbors or something like that, or spouses, spin them around in a chair really fast, stop it, watch their eyes. Their eyes are going ding, 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 ding. It's called nystagmus. And so their brain is saying, I'm moving. Because it thought it got used to moving, and all of a sudden you stop, and it says, well, I'm still moving, so I need to keep looking like
We
this
have to
still.
watch his eyes later. That's one game for later, huh?
So, yeah, so that's kind of a fun thing to play with. But there's a lot of reasons why you can be dizzy, and then there's a whole different thing with just imbalance, where you aren't as steady, very common in the elderly. So that's a whole nother big thing, and I can touch, that one's going to take a little bit more conversation, but I will come back to that. But as far as Jen asked about calorics, and again, I'll talk about more of this later, but some of the equipment we sell caloric irrigators. You can put water or air in the ear, a temperature that is higher or lower than body temperature. And like I said, you've got these canals in there. And so there's a canal that is oriented basically like this in the ear on both sides. And as you heat up the fluid, it rises. So the fluid starts moving, which tells your head, tells your brain, hey, I'm moving, which then tells your eyes to move in a certain direction as a result. And actually, I guess really the canals we're looking at in this case are going to be more like this. And so the person's laying back a certain way, you heat up the fluid, and their eyes start moving. And it makes them dizzy, or if in many cases it'll make them dizzy, not all the time. And it will, but it allows us to measure how strong of a response I get from when I do this side and then this side, and see is there one stronger or weaker than the other, and maybe that's what's contributing to their dizziness. As an aside, getting back to the earwax comment we had a minute ago about the over-the-counter kits, one of the instructions on there says that whatever water, when you put water in and flush your ears out, it should be roughly body temperature, because if it's too warm or too cool, it may make you dizzy. Now, it doesn't last long. Once temperature is neutralized, everything's fine. But you can sit there and squirt cold water in your ear or hot water in your ear and end up feeling like you're spinning. And I do that for fun.
Are there, my mom had vertigo, and the ENT said something about stones or balancing. Are there stones in your ear?
Sort of.
Yeah.
I always get it's calcium carbonate crystals is what it is. Others will say rocks in the head kind of thing, but basically I told you when I move like this, I know I'm moving that way because there is part of the ear anatomy that is fixed to my skull, and then there's part that's floating on this gelatinous substance. So when I move down like this, it does this, which tells my brain, hey, I'm laying forward. And as part of the weight of this top part, there's calcium carbonate crystals that sit on top. Now, if those calcium carbonate crystals break off and get into the other canals that make you feel like you're spinning, if I lay down, everything should be fine, but if all of a sudden those crystals start going through that canal and moving, I start getting dizzy. because until it settles down at the bottom. So it's called benign paroxysmal positional vertigo, BPPV. And again, I can talk a little bit more about that when I talk about some of this other stuff and with balance too. But that's it's probably the most common cause of dizziness. Other questions? I don't even know how we're doing on time.
So we sell stuff for, pure hearing and all the elements of detecting hearing, We'll talk about the other modalities and O.D. and
All that
ADR
stuff.
later on. Okay.
Yep. Oh yeah.
But also the vestibular system, that, when you hear vestibular, it's up in what all the other organs are, and
Right.
components are, but it's related to balance. And then the micromedical stuff would be,
It would be.
vestibular related, and there's some other products as well.
Right.
That's what it's referring to as the balance system,
Yes.
and I think it does other things too, not just balance.
Right. There's some other things you can do, or different ways of looking at the balance system. Anything?
So what are we going to talk about next time?
I was thinking tympanometry, but after some really good questions today, I'm not sure yet. May have to go a different direction. I don't know. We'll
I
see.
got one more.
Yeah.
We touched on the earbuds earlier,
Yeah.
and they also had like the over-the-ear headphones. Is one a little safer to use than the other, or it all depends on how much you want to crank it up?
It's really how loud you want to crank it up.
Okay.
Although it's easier to get it too loud with the ones that go in the ear.
Okay, that's what I was
But
thinking.
the over the ear, you can still.
Still the same.
Yeah, we always found that
Yeah, draw that way, so you
what
can
ends up happening is you overcompensate because of the background noise, so you end up turning it up more.
Right.
Drive out background noise. I would say the ones that suppress the noise around you, gives you that
No-
that
noise
occlusion
canceling.
effect you want, where
Yeah.
usually you don't hear anything else.
Right.
Yeah.
The ones with the
Bowls.
canceling, noise canceling,
Yes.
Yeah.
those are the best. Because
Okay.
you're not compensating for all that background noise.
Exactly right. That is perfect. Yes.
Okay.
Yeah, you played it a lot, that was soft about it.
Yeah.
All right.
Yeah, they played.
If anybody has